welcome to KSP TV. Joining us today we have the lovely Dr. Rashmi Shetty, who's a cosmetic dermatologist. And of course, when you have an expert like that, who all the women want it strong for all the right reasons, we have lots of questions. So let's begin with the first one. Summer skincare for pregnant women and mums.
So pregnant women especially, because you do feel hot. There's a whole lot of hormonal variation. And I've seen most pregnant women come and say, Doc, I have bath like 100 times in a day, and then I'm sweaty and I'm angry and irritable. So therefore I want a cold shower even more. So multiple times having bath necessarily is not a good thing. Because you're pregnant and because there are hormonal variations, your skin also goes a little dry. And dry skin is always sensitive and a little more itchy. Last thing you want to do on a pregnant skin is scratch yourselves.
Right.
You'll end up leading to more stretch marks.
Right.
So most important for summer moms is to make sure you remain cool. So stay in an ambient temperature which is not too high. Make sure your humidity in the room is not too high. So switching on an AC keeps your mind and body calm and cool. And then you can use something like a rose water frozen in an ice tray.
Mm-hmm.
You can even use tender coconut water frozen in an ice tray. So use a cube of ice and nicely rub over your face, especially so that your face doesn't feel flushed and hot and irritated all the time. While you're having bath, it's better to have it in cold water, maybe slightly warm but not hot water.
Yes.
So that's something that you can do. Pre-bath oiling is a fantastic thing to do. So you're keeping yourself hydrated but not sticky through the day if you're trying to do a post-oil bath.
Right.
So it's better in summers to do a pre-oil bath.
Water.
Don't forget about your sunscreens.
Right.
Though you're a mom-to-be, maybe you're like so irritable in the morning that you don't fit. Last thing you will think is probably of skincare. But please make sure you apply your sunscreen regularly, and make sure you're applying your night cream, and choose a night cream which has a skin lightening ingredient in it, something natural like a vitamin B complexes. There are B3, B6, most of them, or more acids like kojic acid, azelaic acid, which are more natural based acids,
Right.
AHAs and BHAs. So that kind of keeps your skin lighter. Also, don't forget using the creams on your neck.
Right.
Because during pregnancy, you start getting pigmentation on your neck,
Right.
on your face, on your creases of the body. So these are
Right.
parts that you end up using creams with certain skin lightening ingredients always.
Also, I think you touched upon pigmentation in pregnancy. That's an absolute synergy, right? Like everybody is thinking stretch marks and pigmentation. Does it ever go back to normal?
I'm afraid not. Pigmentation does, but not stretch marks. So once you get stretch marks, which means your skin is actually tearing. So once the skin, almost certain fibers are tearing in it, certain fibers are breaking, especially the elastin fibers. So and collagen sometimes stretches beyond repair. So once that happens, and then there is a telltale sign on the skin, you can minimize the stretch marks, you can reduce the appearance of stretch marks, you can later bring them down, the way they look, the color might be made better, but you cannot erase it out of your skin. That's not happening.
That's not happening.
Yeah, but pigmentation pretty much goes back to absolutely completely cleans up once your pregnancy is over, whether you do something towards it or don't. So this is something for all the moms who really rush to the doctor's clinics. Don't just go hyper. You just calm down, finish with a baby, 3-4 months, just wait it out. It really goes. Most of your pigmentation vanishes with it.
Right. Is there anything that you can do to address pigmentation? While you're pregnant.
While you're pregnant. So while you're pregnant, the best thing is to make sure you don't use too much of friction, too much of heat onto the body. So you're not agitating the skin, which is already irritated. And if you do have a red and a dry skin, make sure you use a lot of softeners, skin lubricants, skin hydrants. So you're not irritating the skin to cause a post-inflammatory hyperpigmentation. And make sure don't look at those pigmentation on the neck and go scrubbing. That will only make it worse. Use skin lightening agents which are more natural, something like a vitamin C, vitamin B6. So all of these skin lightening ingredients, natural things like using lemon and curd at home, maybe honey and curd at home. So these kind of hydrates as well as acts as a skin lightener. So these are things that you can do at home to kind of make it a little less
in your
dark,
face,
in your face kind of a thing. But post your pregnancy is when you start really taking care of
it.
Yeah.
Right. Pregnancy and breakouts.
Yeah.
Your skin just changes.
You know, surprisingly, there are some people who have breakouts all their lives.
Yeah.
Pregnancy, skin clears up.
Yeah.
And some people get terrible breakouts while they're feeding. because there's a hormone which goes up at that time.
Right.
So therefore, it depends on entirely a hormone mix-up and make-up, which usually is at its height at that time. So if you're prone for breakouts, you could have breakouts, but don't go nuts with it, because when the hormone settles down, this settles down too. Having said that, acne settles down and not the scars.
Right.
So you need to be careful about how you take care of your acne at that time.
Right.
So make sure you use creams which are safe during pregnancy.
Great. Thank you so much, Dr. Shetty, for joining us. And if you have any more questions for Dr. Shetty, please leave them in the comments below, because we promise to get her back on KSP TV and get all your questions answered. Thank you.
Lovely. Thank you so much. Thoroughly enjoyed it.